Upstate Medical University in Syracuse, New York, invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. The dengue virus spreads from the bite of an infected mosquito. It's an endemic disease in more than 100 tropical and subtropical countries. So if you're traveling, how can you keep yourself safe? I'll be talking about dengue with Dr. Katie Anderson, the Onondaga County Health Commissioner and an associate professor of microbiology and immunology at Upstate. Welcome back to The Informed Patient, Dr. Anderson.
Thank you for having me, Amber.
Have any cases of dengue been reported in Onondaga County in recent years?
Onondaga County and Central New York more generally are home to a variety of concerning mosquito-borne diseases that we won't be talking about today, Eastern equine encephalitis, West Nile, and some others, but thankfully we're not home to dengue. This is, for now, due to the fact that there are two major mosquito species that spread dengue across the globe. They're called Aedes aegypti and Aedes albopictus, and thankfully neither of these mosquitoes are found in our region. However, Aedes albopictus is found in southern New York, and so we're watching very closely to see what may happen.
So have we had any travel-associated dengue cases where people got bit when they were traveling and then came back home to Onondaga County?
Dengue is unfortunately a rather common travel-related infection, and so people do bring it back. It's a reportable disease in New York State, and we've had 8 cases in Onondaga County over the last 5 years. These were all travel-related, so people who had just returned home from places where dengue was spreading and brought it back to the county where, again, we don't have the mosquitoes and it didn't spread further.
Now, why is dengue such a concern?
Dengue is a concern for multiple reasons. So as you mentioned, about 50% of the globe is at risk for infection with dengue. If you look at the distribution of the mosquito and therefore the distribution of dengue, it's really all tropical and subtropical regions of the world with a distribution that's expanding as the vector starts to expand its range as well. So just in terms of the sheer number of people who can get dengue, it's a huge public health burden. The severe disease with dengue, and it can be quite severe, tends to be concentrated in our more vulnerable populations, like most infections, but in particular children. And so that can be quite tragic and devastating in areas that are hit hard by dengue. Dengue has a huge impact on our health systems, or I should say health systems in dengue endemic areas. So it happens in distinct seasons. So typically the rainy season, for example, or the monsoon season. And when people are infected with dengue, and in particular afraid that their child may progress to severe dengue, the healthcare systems end up being flooded with patients beyond what they can handle because of this concern that they may have dengue. And then lastly, it's such a major concern and a major research priority, actually, for us here in Central New York and at Upstate, because there are a lot of unanswered questions with dengue that stand in the way of developing antivirals. We have no specific treatments for dengue. It has stood in the way of developing widely available dengue vaccines for many decades, although there's been some progress with that. And controlling the mosquito has been a long-standing public health problem globally. This Aedes aegypti mosquito spreads not just dengue, but also chikungunya, Zika, yellow fever, other major public health threats. So dengue is a huge global problem, and it's one that we do not yet have all the tools at hand that we need to prevent it.
Are there more cases of dengue and the other mosquito-borne diseases, or are we just hearing more about them?
Yeah, so dengue is the most significant arboviral disease globally, which means that if we look at all the mosquito-borne viruses, yellow fever, Zika, Triple E, dengue tends to cause the most deaths and the most infections. It's a very, very prevalent disease and one that's increasing its footprint. Some of them can be more severe. So if you were to ask me, would I rather have dengue than yellow fever or chikungunya? Some of them cause more severe disease and can be more fatal. But in terms of sheer numbers of people who are infected, dengue is at the top of the list, typically.
Before we get into the details of the disease itself, where is dengue fever considered endemic?
It's found any place that is hospitable for this vector Aedes aegypti or Aedes albopictus, which is most tropical and subtropical regions of the world. So Central America, South America, the Caribbean, Africa, Asia, and Southeast Asia probably have the greatest burden currently. But there is an increasing incidence in some specific areas. The epidemiology is changing. So Southeast Asia, where we have worked for over 30 years, has had a strong and steady burden for quite a while. Latin America is having an increasing burden. So people may remember in 2024, it was the largest dengue outbreak on record, and the WHO declared an emergency due to the sheer number of cases in Latin America. And we're seeing a dramatic uptick in numbers of cases there. And then lastly, one thing that we're watching very closely, that due to changes in climate, we're seeing some areas that were not previously hospitable for dengue and the vectors, like Southern Europe, potentially some parts of the United States, become home to these mosquitoes and then start to see some limited transmission there. So it may be that it may start to spread into some newer areas in the coming years and decades.
So in the US, places like Florida or southern states that
Yeah.
probably have mosquito problems to begin with, right?
Right. So actually, the history of dengue in the United States and other mosquito-borne viruses is pretty interesting. Back in the 1700s, we had a lot of dengue. There was a huge outbreak of dengue in Philadelphia in 1780. Um, and then due to development, increased sanitation, we don't have the vector as widespread. We certainly don't have local transmission of dengue reliably in the continental United States. We do have, I should say, in the US territories. Puerto Rico is highly endemic for dengue, as are other territories. Each year, we can see some limited transmission, not every year, but in places like Florida, Arizona, Texas. There have been some studies that have looked at very interesting things like why would you have on one side of the US-Mexico border a lot of dengue transmission and just across the border in the United States, very limited. And there are several factors which are intuitive, but are protective to some degree in the US, like presence of air conditioners, screens, other things that are more associated with protective environments. That said, we are definitely vulnerable, and we are definitely seeing some potential for increased transmission in the southern US.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with Onondaga County Health Commissioner Dr. Katie Anderson, and our topic is the dengue virus. So what advice do you have for someone who has travel plans to the Caribbean or Brazil or Vietnam? What can they do to protect themselves while they're there?
That's a really important question, and one that should be coming up at travel medicine visits when you should take advantage of travel medicine visits before you travel. And dengue, for most regions of the world that are tropical or subtropical, should be a topic that comes up. The disappointing news is that there is not a lot that you can do for dengue in terms of a pill you can take or a vaccine that you can get if you're an American. The most important thing that you can do is to be paying attention to the context. So what's happening in the region that you're traveling to right now? So dengue is endemic in a large part of the globe, which means it's there every year, but it's also epidemic. So in 2024, as I mentioned, there was a catastrophic outbreak, particularly in Brazil. So if you were traveling to Brazil that year during that rainy season, it would have been in your best interest to be very avoidant of mosquito bites during that travel. Paying attention to, is it the rainy season? Where are you traveling to? And are they experiencing an epidemic? The other thing that's important in terms of preventing against mosquito bites and dengue for travelers is that this mosquito bites from dawn to dusk. It doesn't bite overnight like the malaria mosquito. So bed nets don't work. The guidance typically for malaria, by contrast, is that if you're in an urban area and traveling, you're not at significant risk. Dengue can be definitely an urban and a rural disease. So wherever you're traveling, you could be at risk of dengue. So it comes down to, unfortunately, simple mosquito bite avoidance. So bring some high quality DEET, which would typically be 20 to 30% DEET or 10 to 20% picaridin. Those are sprays that actually work. We've talked about them before for tick-borne diseases here. Safe for anyone who is over 2 months of age. If you can handle it in a tropical or subtropical environment, long sleeves and pants can help, and possibly embedding those clothes with permethrin, which can help you avoid mosquito bites. And that's really the main advice, is to try to avoid mosquito bites for travelers.
Is there any recourse after the person has been bitten?
Well, so I will mention two things related to that. So when we talk about tick bites, one of the central questions is, how long has the tick been on you? Because some of them may take hours or days to transmit a disease. These mosquitoes are so well adapted to feeding on humans, these Aedes aegypti mosquitoes, that it can take a matter of seconds for them to inject their saliva and inject dengue virus. So it can spread quickly, and it can spread in a couple seconds. After you've been bitten, there's nothing can be offered in terms of a post-exposure prophylaxis. I will say these mosquitoes are also so abundant in tropical and subtropical regions of the world that it is hard to avoid bites. So best you can do is try to avoid a bite. If you are bitten, there's nothing that you can do except for monitor for potential signs of the disease.
You mentioned travel medicine. Does the county offer a travel medicine clinic?
We don't. We have the services in the county, but we do not.
Now, let's talk about the most common symptoms of dengue. If you're traveling and you do know that you got bit by mosquitoes, what should you be on the lookout for in terms of symptoms?
So first, to reassure people, um, our and other people's research has shown clearly that most of the time, if you're bitten by a dengue infected mosquito and you get infected with dengue, you actually don't have any symptoms at all. At least 50% of the time, maybe more. If you do develop symptoms, most people will develop something that's classically known as dengue fever, which is an acute infection. There's no chronic dengue. It's largely non-fatal dengue fever, but it is meant to be quite debilitating, enough to ruin a trip, or that's been a major focus of the military, for example, for a long time, because historically it could really impact military operations. So it's an acute, self-limited disease lasting just a couple of days, but it can be quite profound and debilitating. The most common symptom is fever, but it's often associated with severe muscle and joint pain, which is one of the reasons why dengue has also historically been called bone fever, because it's meant to be quite painful. You can also have a headache and pain behind your eyes, as well as a rash that can kind of be like a sunburned rash. There's a lot of different rashes you can get with tropical infections. This one is like you put your hand on somebody's arm or on their back and lift it up, and it's like a sunburn took place. But all that said, the symptoms are quite similar to a variety of other tropical infections and quite similar to flu and other things that may cause a fever. So it can be somewhat hard to discriminate.
But the person's not infectious to other people, right?
That's an important question. Right. So dengue does not spread person to person. It has to spread from mosquito to human, or there are limited cases of spread by needle stick, for example, but it's a mosquito-borne virus.
Does the person need to see a doctor to determine whether they have dengue? Or can that be done?
Most of the time, if you have dengue, you are going to be fine if you stay at home and rest and drink fluids and take some Tylenol. Since we don't have an antiviral, the focus typically is not on early diagnosis because there's not much that we can do for you. There's not specific treatment that can be given. So most people can recover at home with conservative symptomatic management. In endemic areas, even if you go into the hospital, it's usually a clinical diagnosis, in part because of the lack of advanced laboratory capabilities. There are things like PCR tests where you can detect the virus in the blood. That's typically more for hospitals with advanced labs or surveillance reasons. There are other tests that look for the presence of viral proteins in your blood that can be point of care tests, kind of like what we had for COVID. But those are, again, somewhat expensive and not 100% accurate. So diagnosis typically goes based upon, is it the right time of year? Is it the right place? Is there a lot of dengue in the area right now? Are the symptoms more or less consistent with dengue? And do they have, for example, a low white count and low platelets that could go along with dengue? But typically, people are not specifically diagnosed with dengue.
Now, I've heard there's 4 different types of dengue viruses. Does that matter which one you get?
It matters not clinically necessarily, but it matters for other reasons. And I'll go into that a little bit. So dengue is uniquely challenging, I would say, and uniquely interesting in that it has 4 different viruses, or we also call them 4 serotypes. And there's a lot of other infectious diseases out there that have multiple serotypes. Polio is a famous one. HPV is another. So what this means for dengue is that you could be in places like Thailand that have all 4 serotypes in circulation, and you probably will be infected with dengue 4 times in your life. So it increases the incidence of this disease, the sheer burden, by a lot. Places like Latin America are getting new serotypes introduced each year, so their incidence is going up for that reason alone, that there's just more dengue going around. But the reason that this really matters for dengue, and this has posed a huge challenge for developing vaccines, is that the clinical outcome of your infection or how sick you get seems to track along with how many times you've had dengue. So interestingly for dengue, and this is something that came up a lot when I was practicing travel medicine, you can get very sick the first time you get dengue, but actually your highest risk of severe disease happens with your second infection with a different serotype than you had the first time. So there's something about how your immune system is changed after your first exposure to dengue that runs the risk of you actually getting sicker the second time that you get dengue. We don't fully understand what role the different serotypes themselves may play in that sequence. Are there certain serotypes that tend to be more severe with the second infection? Maybe, but certainly the sheer number of infections you've had plays a major role. When I was practicing travel medicine, I would meet people who were dedicated, avid global travelers, and they would say to me, well, I had dengue once, so I'm going to stop traveling now because I'm at risk for
Mm.
severe second infection. And what I would tell them and what I would tell everyone is that that would be a call for increased caution. But most of the time, when you get a second infection, you're actually totally fine as well. So it's not a reason to stop traveling, but it's a reason to just be a little bit more cautious. And it would be a good reason to get the vaccine if you found yourself in a place that was administering it.
I wonder, is this more of a concern for the vulnerable people, the babies, the elderly, pregnant women? Do they need to take this more seriously than a healthy adult?
Yes, the short answer is yes. So if we look at, again, in endemic areas where the greatest burden of severe disease and death occurs, we see, let's say in Thailand, for example, we see a high burden of severe disease in older children who might be getting their second dengue infection. So they're primed to have more severe disease. But we also see a burden of disease in elderly individuals in places like Singapore, for example, that most of their deaths occur in elderly individuals. And then other individuals who don't have as strong immune systems, for example, pregnant women, people with chronic diseases, and infants would also be at higher risk.
Can you tell us about the typical course for the disease?
As I mentioned, if you're infected with dengue, most of the time you may have no symptoms at all. If you develop symptoms, you most likely will develop dengue fever, which is non-fatal, often can be treated at home. But the true challenge with clinical management of dengue, and one of the reasons why it's so feared in places that are endemic, is that there's also a second phase that can occur with infection that's very unpredictable. And this is where severe disease comes in. So if you become sick with dengue, you may have a fever, you may have joint pain for, let's say, 4 to 5 days. An unpredictable, smaller proportion of people may go into a phase where their fever clears, but then they go into what's called the critical phase, where they may then develop hemorrhagic shock. They may start leaking fluid out of their capillaries and starting to lose blood volume. And those are the folks who could die from dengue. And it's really hard to predict who is going to become severely ill and who is not, which is one of the reasons why health systems become so overwhelmed. The other challenge with severe disease and dengue is that the management of it is quite intensive, even though the tools that we have to manage it are quite limited. So again, there's no antiviral for dengue. The cornerstone of treatment is very cautious fluid replacement. And so places like Thailand that are very used to seeing and managing dengue have whole wards that are dedicated to watching people through this critical phase, checking their blood pressure regularly, giving them back fluid aggressively at first, and then starting to back off the fluid so they don't overwhelm their system as they start to improve. So it's a very intensive process. And the mortality rate with dengue varies a lot depending upon what resources and familiarity the hospital may have with respect to dengue.
Are there medical conditions a person may have that raises that person's risk of having the severe reaction?
That's a great question. So when we look at places that are inexperienced with managing dengue, so this would be outbreaks in places that haven't had them before, young children can be at particularly high risk just because of the challenges of fluid management. So if you flood a small child with fluid, that can be much more easily tipping them into issues with their breathing and fluid overload. The other major challenge that we're seeing in other areas that have had dengue for a long time is, for reasons that we don't fully understand, we're starting to see more dengue in adults. And adults come into this infection with sometimes underlying heart issues, underlying kidney issues where they are also very fluid sensitive. And so the means of managing them so that you're helping prevent shock or pull them out of shock and get fluid back into their system without pushing them into a situation where their lungs are flooded with fluid or they're otherwise fluid over is very challenging and something the field is trying to evolve and adapt to.
So prevention really is key at this point.
Prevention is everything at this point. I will mention two things in terms of optimism, because otherwise I've laid out a very challenging global threat that's worsening. We do have some increasing tools that are very exciting. There is one widely available dengue vaccine, not available in the US, unfortunately, but manufactured by Takeda. It's called Qdenga, that's now widely available and seems to be generating good protection. So that's good news. And then also in mosquito control, not just for dengue, but for all these other viruses that Aedes aegypti spreads, there have been releases of Aedes aegypti mosquitoes that have been infected with a harmless bacteria, a gut bacteria that spreads mosquito to mosquito and has two benefits of reducing the mosquito population, so it makes them less fertile. It also decreases transmission of dengue, Zika, yellow fever, all these other viruses. And those have shown very good and lasting success in places like Indonesia, where there was a large release and some great studies, and some ongoing work in Brazil and other places. And that's called Wolbachia, is the name of the bacteria. So there's some real promise on the horizon, but this is a very challenging, fascinating, persistent global problem.
Well, thank you again for taking time to tell us about it.
Thank you.
My guest has been Onondaga County Health Commissioner Dr. Katie Anderson, who's also an associate professor of microbiology and immunology at Upstate. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.